So, waiting to go in for my surgery. I had my pre-admission last week. I now go into surgery in 3 days' time. On Friday morning, 7 a.m, I have to be on the A3 ward at Addenbrokes, which is the day surgery ward. I'll be leaving Norwich about 5. Waiting to go in. I mean, how do you prepare yourself for that? I've got my little bag, my little case prepared. I've got my PJs. Just got a book. What do I need? I don't know if I'll be able to focus enough to read or watch films on the iPad. Who knows? We don't really know what's going to happen yet, because it all depends on how much the surgeon can take out. So what's going to happen is, Thursday night I've got to wash my hair, shower with this special antiseptic bacterial solution. I have to wash my face, my hair and everything with that, ready for surgery that morning. And then we'll leave at 5 a.m. Can't eat anything after midnight, but I won't be hungry. I can't be hungry for the next couple of days, to be honest. See my surgeon, ask any last questions, give my mum and my boyfriend a kiss, not for the last time, of course, and then just go in. I'll be going on to general anaesthetic because of where it is in my brain. They don't need me to be awake. A lot of the times they need patients to be awake for brain surgery because they need to know they're not cutting into healthy tissue. So they'll always need the patient to speak or move their arm or wiggle their toes, just to show they're not harming any delicate brain tissue. Whereas with me, there's nothing really around it that they can hit, so they're confident that they can do it purely with just me being asleep. It's going to take about 5 hours. I hate to think how my mum's going to be coping for those 5 hours. My boyfriend's pretty chill. He's always calm, so hopefully it'll be good for her to have him there. He'll calm her down. I can imagine she'll have a bottle of red wine with her, just for stress. And then they'll get to be there when I wake up, which will be nice. I've asked my boyfriend to video me waking up, just so I've got it as a record of what happened, because I won't remember. But not only that, but so other people who have to go through it, they can know what to expect. I can put it on my blog and they'll know, them and their families, friends, boyfriend, whoever's going to be there, will know what it's like and what they might go through, because it can be confusing. That amount of trauma to the brain, I might not know who people are. I might not have any strength to move my arms, to feed myself. I might not be able to walk for a couple of days. I've heard of people, they can't just do anything for a week. They can't pick up a pen or a fork or anything. They need absolute help all week. So I'd be very interested to see what's going to happen when we wake up. I'll have an MRI scan 72 hours after my surgery. I'll be in Addenbrokes for, I'm guessing, around 4 days. Sometimes they need to put a drain in to your skull if it swells up to let any fluid out, like with any surgery. I'm hoping I don't have to have that. What they're going to do is, instead of shaving my head, they're going to make an incision, because normally they cut all the way around there. They have to remove about this much of your skull, which is a hell of a lot of skull. It's not just a tiny trapdoor, it is a sizable portion of your skull, about this big. What they'll do is, I've been watching the videos, they'll remove it, they'll cut my hair down there, peel it all back, so I don't have to have my head shaved, which is nice, but it sounds a bit gross peeling it all. They'll cut my skull off, they'll snip through that tiny little layer of baggy, skinny stuff. I don't know what that's even called. Just the sac that your brain is in. They'll snip through that, and then they'll start cutting away at my brains. Take the tumour out, which is going to be a nice little globule bit about this big of just whatever the hell it is, tumour cells. Is it tissue? I don't even know what you define it as. But anyway, my tumorous friend is going to be cut out as much as possible. And then I think they stitch it up, glue your skull back on, and I've seen they use these little plate things. It's like a little round, like hinge or something, and they'll on there a couple of metal plates, and perfect for setting off all the alarms at the airports when I go through security. And then they'll just glue your skin back onto your head, and then stitch it, and I don't know. Maybe they'll give me a little mini facelift. I'm joking, I don't need that just yet. Next time. And then I'll probably have a scar just running around there, which you won't be able to see. So much better than having all my head shaved and then a nice big scar that looks like I've been stabbed in the head. I'd look badass though. No one would mess with me with a shaved head and a scar running all the way along there, I'm sure. Probably cause some trouble with that. But so that's what's going to happen. I'll have an MRI in 72 hours. I think that is to show how much of the tumour they got out. And then we'll be discussing chemotherapy. It is cancerous. It is going to grow back. If they got enough out, just to leave a tiny little bit, maybe I won't need chemo because there won't be enough left to kill. You can never kill these tumour cells off completely. There is always something remaining for it to grow back from, unfortunately. With the type of brain tumour I have, it's a curse for life. So we'll know whether I need chemo or not. And then I'll be in hospital for a few days. They're going to give me steroids. I'm going to get buff. No. What these steroids do is, it's after surgery or trauma like that, your brain swells. And of course, if your brain swells, it'll hit the skull or things like that. You can have seizures. It can cause all sorts of complications. So that's what we need to make sure it doesn't happen. So the steroids they'll give me will make sure my brain doesn't swell. So I'll have maybe 2 or 3 days of steroids. Apparently they plump you up like a fat little marshmallow. So I might have chubby cheeks and a big old belly and just swollen for a few days, but I'm going to be extra healthy. Not a fan of hospital food anyway, so I'm going to take my nutritional shakes with me. So I've got lots of nutrition going into my body, lots of protein, and just try and be as healthy as I can because I don't want to. I know gaining weight is something trivial when you've just had brain surgery, but the steroids are going to lead to me holding a lot of water and weight gain anyway, so I just want to make sure my body is just as healthy as it can be, so it all goes away straight away as soon as I've come off the steroids and I'm back to my usual size again. I don't want to be walking around like a little chubby monkey. So as soon as I come off the steroids, the weight will be gone again. Not that I'm too worried about gaining a few pounds. My life is way more important than that, but at the same time, it's just not nice when you feel bloated and sluggish and horrible, and so I want to feel as healthy as I can inside and look as healthy as I can outside as well.